Well, the healthcare sector probably has more diversity in job offerings than almost any sector of the economy. We employ 13,700 people here, and that employment comes in the form of hundreds and hundreds and hundreds of different jobs. And sometimes people think of healthcare solely on what they see on TV, on ER or whatever, with doctors and nurses. And the reality is there are people not only at the bedside, doctors, nurses, nursing assistants, and the like, but throughout our hospital we have people both on the front line of taking care of patients and behind the scenes. The front line, a lot of technology positions, things like physical therapists, laboratory technicians, radiology technicians. We have many, many technology jobs that don't take anything like what it takes to be a physician or an RN. Some of it's certification, some of it's associate's degrees. We also have, numerous jobs that are more along the lines of entry level. We employ hundreds and hundreds of clerical people. We have numerous positions throughout our support functions in ancillary areas, support areas like dietary, housekeeping, our facilities and the like. So it ranges the whole gamut from entry-level positions that take nothing less than like a high school education to, of course, we have 1,700 physicians also that work within our healthcare system. Unquestionably, healthcare is going to provide a lot of opportunities for people here in Worcester and for people throughout the country. I was in Chicago yesterday and we had lengthy discussions about having not enough of a pipeline of workers coming in virtually throughout every segment, whether it be technology, whether it be nursing, in a lot of our medical fields, in a lot of our physician specialties as well. So we're looking to create a pipeline both outside the buildings and within the buildings. We're looking, for instance, with our youth employment. And one of the people, a lot of people in the community think we're doing that as charitable work. We spend several $100,000 a year on youth employment. It's not. We're trying to attract people and interest people in healthcare professions. And year in and year out, we have probably about 400 young people that work in one of our facilities. And at the end of each summer, you've been with us, we've talked to a lot of the students, and they say the same thing. I'm going to be an ultrasound tech. I'm going to be an orthopedic tech. I'm going to be a patient care assistant, a nursing assistant. Then I'm going to go on and get my associate's degree, become an RN. And so we're looking to interest people. Once they get here, we're always looking to move people along. I was at a function the other day and I met a young woman who was a nursing assistant, but she was also pursuing her nursing degree over at Quinsigamond Community College. We're always promoting that. Once you get inside our walls, we're looking to have you move along. We have a very attractive tuition plan, but we also carve out a variety of other plans for people depending upon their specialized interests. And as we say here, looking at youth employment, which is something that I benefited from, and that early on at the age of 15, it really created a pathway to become the CEO of a $2.5 billion corporation. We're looking to provide opportunities for other people, and we're doing so not only to benefit the community, we benefit ourselves because we're getting the rich talent from this community, we're attracting the diversity of our community, and that makes us a stronger organization. It also makes us an organization that's more reflective and representative of our community.